publications, over 50 book chapters, numerous invited lectures, popular articles, and several Best Paper Awards to his credit. He is an active researcher in various facets of pharmaceutical sciences and biotechnology. He has completed 15 major research projects granted by various governmental agencies like Ministry of Ayush, DST, ICSSR, ICMR, FITM, PSCST, AICTE, etc., and also transferred two technologies to leading pharmaceutical industry. Today, on fifth day of faculty development program, he will going to deliver his topic on new PCI curriculum, the process and outcome. Welcome you, sir, on today's session. So the platform is now yours. You can begin your session, sir.
Thank you so much, Amlan. Am I audible?
Yes, sir, you are audible.
Is the slide visible?
Yes, sir, it is visible.
Yeah. So thank you so much for a wonderful interaction. It was way beyond what I have done as a teacher. But dear friends, since we are colleagues and co-learners in the profession of pharmacy, I would like to introduce myself as a proud teacher and forever learner. So at the outset, I would like to thank Dr. Biplav, Principal Bharat Technology, Dr. Amlan Bishal, who is the coordinator of today's session, and whole team of Bharat Technology, who is doing wonders in pharmaceutical education in that particular area. I think this is very good initiative which the institute has taken to brief up the teachers of that particular region and across India. So, since I was involved in the curriculum designing and finalization, so I would like to provide you insights on the curriculum also, and also we will understand that how and what is the need of this changes which is coming up with the new curriculum. So, at the initial with these initial words that ज्ञान की इस लॉ को चलो मिलकर जलाते हैं, कुछ को मैं जगाता हूं, कुछ को आप जगाइए. So dear friends, we are here to discuss the basically that how new PCI curriculum has been incorporated with the design of outcome based education. So when we talk about this, let me first welcome you on behalf of my institution, that is Maharaja Ranjit Singh Punjab Technical University, and this is the building of my department. And let us discuss that how this particular curriculum will be a great addition to the pharmacy profession as far as the progression of students and teachers are concerned. So, first thing, that why it was needed. I think you all knows that last 20 years or so the curriculum remained same, and then the demand of the healthcare system and the profession changed rapidly. And with the avalanche of COVID-19, we understand the role of pharmacist in the health profession, and we got the idea that it is very necessary to change the curriculum and prepare our future pharmacists for the global context. And therefore PCI thought of that there is a need of curriculum reform in pharmacy education. So if we talk about outcome based education, you all know, but in simpler words, we have to understand that after graduation or post graduation, what students should need, and what skills or what achievements or what practical aspect, practical learning they can have, and how we will assess that particular thing, that whether students are going in right direction or not. uh, Instead of rote memorization, whether he is learning the critical thinking aspect, whether he is doing the real world problem solving, that incorporation needs to be inculcated in the curriculum from backwards. So backward means what? That first we understood that what are the need of the hour, and then we inculcated all those expected outcomes in the curriculum, and then designed the curriculum. And you will feel, after seeing, you must have seen the curriculum, you are seeing that one thing which we have taken care is uniform distribution of specialization based subjects. Second thing, we have taken care of very good inculcation of practical aspects, almost equal to theory and trainings. And then we have also taken care of some of the new advances like artificial intelligence and other things, so that we can make our students ready for the future. So why it is needed? It is needed because the industry is going at its own pace, and our old curriculum does not align with that. So industry alignment was necessary. Then we have to produce skilled graduate which are competent enough for global settings. So what skills we should incorporate, and along with it, holistic development of students, so that they can not even contribute in pharmaceutical context, but also globally and socially. So these are the things which we have taken care, and spanning across 8 semesters, we have choice-based credit system, multiple different subject core subjects of pharmacy. Along with that, the optional subjects, or what we can say, the choices of the spectrum of the subjects with the student. Sorry, with the students uh, are very wide in this case. They can ranging from food to artificial intelligence to chemistry to computational things and so on. They have a very good choice of subjects in the new curriculum. And then more importantly, rather than the end semester examinations or something, we have a focus on continuous evaluation of students through hands-on competencies throughout their academic journey. And then the program outcomes have been defined in such a way that our student should be holistically developed as far as pharmacy knowledge is concerned, modern tools and instrumentations are concerned. They should have leadership skills and professional ethics. So uh, one is clear expectation is to define the learning goals so that we can improve the teaching focus. Another one is flexible teaching pedagogy, so that we have various student oriented teaching practices. The interdisciplinary integration basically of artificial intelligence, food and technology, and even we can say the chemistry aspect, the drug discovery aspect, and all pharmacovigilance and other setup, that also has been taken care. And the practical emphasis is more towards the industrial practices in those particular subjects. So what is our expectation? What we will do after implementation of this particular curriculum is, we should have patient care excellence. Here we have a training in community pharmacy, in hospital pharmacy inculcated in the syllabus. Enhanced employability, because they will have the skill sets. And these are all assumptions, because the initial practice of OB is largely rely on all of you being a teacher. Then innovation and research, and then the global need and skills. So these are the expected outcome, that our students will be competent lifelong learners. One thing we should realize, कि जब से हम लोगों ने पढ़ाई की थी एज ए टीचर, एज ए स्टूडेंट, that also we have understood, and now a lot of things have been changed. So it's a lifelong learning in the profession always remains. So your basic should be strong, and then only you can grow along with the horizon of the profession. So that is what is expected from this new curriculum. Now we have to understand that why it is needed. Because if we see the pharmacy education, there are three pillars of education. One is institutions, another one is teacher, and then the third one and the most important is students. I know that all of you might have been thinking that this is all which we have been talking since years, that outcome based education should be there. Even the accreditation agencies have been taken care of it. But see, one thing we have to understand, that we have to work upon some competency domains. Like, we cannot be an uh, I can say that we cannot be excellent in one domain. We have to understand the multidisciplinary aspect of the knowledge. We have to understand the application part of it through structured internship, clinical clerkship, hands-on projects, or something like that, so that students get exposed to the real practice in the world. And then what skills we should impart to students, and then their attitude should be for forever learning with empathy in social setup. So we will understand that what is the need of multidisciplinary opportunities. Now, before understanding this, we have to think that why the skills, or why the changes in the education system is needed. Let me give you an example. आज से पहले 15 साल पहले हम ट्रंक डायल करते थे और फोन लगते थे, एंड नाउ वी हैव स्मार्टफोन्स. Similarly, 50 years ago we have cars like this, and now we are talking about driverless cars or smart cars, AI based cars, and so on. Now, this is 50 years ago, the 5 MB hard disk was this much big, and now we have terabyte disks in our hand. But surprisingly, this is a picture of 150 years ago classroom, and this is the picture of the actual setting right now. So that means the world has changing at a rapid pace. But what about the teaching practices? Our teaching practices currently are like this, कि हमारा एक टीचर एग्जाम लेता है, और उस एग्जाम में जो बच्चा जितना परफॉर्म करता है, हम उस बेस पे ये मानते हैं कि उसका आईक्यू या उसका प्रोफेशनल जो नॉलेज है वो उस लेवल का है. पर हम ये एग्जाम्पल लेते हैं कि ये टीचर बैठे हैं हमारे जैसे ही, और उनकी क्लास में जो स्टूडेंट्स हैं वो बंदर है, पेंगुइन है, हाथी है, मछली है, और भी कई एनिमल्स हैं. और हम उनको ये कह रहे हैं कि जो इस पेड़ पर चढ़कर दिखाएगा वही टॉपर होगा. तो डेफिनेटली इस सेटअप में कहीं ना कहीं हम एडवांटेज जो दे रहे हैं वो उस बंदर को दे रहे हैं कि वो टॉपर अपने आप बन जाएगा. बट अगर मैं यही सेटअप समुद्र में जाकर या नदी में जाकर रख दूं, और कहूं कि जो नदी को पार करके दिखाएगा वो विनर होगा, तो मोस्ट प्रोबेबली जो फिश है, जो मछली है, वो जीत जाएगी. अगर मैं यही सेटअप ले जाकर नॉर्थ पोल या साउथ पोल में रख दूं, और उनको कहूं कि इस बर्फ में आप कुछ करके दिखाइए, तो पेंगुइन माइट बी द विनर. So that means that it is not on the basis of examination pattern we are deciding the future of the students. We should decide the future of the students based on their own skill. हर बच्चे में अपना एक टैलेंट है. हम हर टीचर यही बात करते हैं और हमेशा कहते हैं कि एवरी स्टूडेंट इज अ यूनिक स्टूडेंट. बट अवर एजुकेशन सिस्टम इज नॉट प्रोवाइडिंग द अपॉर्चुनिटी for all those students to explore their skills, to explore their competencies, and to understand that where they are good. So we have to inculcate critical thinking, and also we have to provide them the multidisciplinary opportunity, that okay, you understand the basics of pharmacy, but if you want to go to computer science, you can take AI aspect. If you want to go to some research aspect, you can do that. If you want to go for food and nutrition industry, you can do that. If you want to go for quality control and analysis, you can go there, and so on. So that means, depending on the interest of the student, multiple opportunities should be provided in the curriculum itself, so that they can choose. And that's where the new curriculum is designed in such a way that our education system, the pharmacy education system, will expand its horizon to understand students' need and to cater them. Obviously, student might not be that much aware, but it is again a system of education always depends on teachers like us. So we have to understand that we have to inculcate that feeling that, if you are in pharmacy, you are the best or something like that. It is not needed. But what is the best? If you are sincere enough towards your profession, if you are sincere enough towards learning the skills which is needed, if you are sincere enough to have practical knowledge, now the onus will be on such professionals. So that means nobody is best. If you have sincerity, if you have hard work, if you have a dedication, I think everybody will be a winner. Sorry, in this particular scenario. So we have to understand that being a teacher and also being for the students, we have to understand the importance of self belief. आप सब जानते हैं प्लेसिबो इफेक्ट क्या होता है. अराउंड 42% ऑफ द पेशेंट्स कैन गेट ट्रीटेड विद द प्लेसिबो. So without giving API, just it is just the belief that I will be okay. The patient gets okay at a rate of 40 to 45%. And that's why, if you believe in yourself, I think you can do wonders in any profession. So, that feeling we should inculcate in students. This is, my dear friends, one of the example I am quoting, that what is the power of self belief. अपने ऊपर आत्मविश्वास अगर आप रखिए तो कितना पावरफुल होता है. ये एक लेडी हैं, और ये लेडी स्टेट लेवल बास्केटबॉल प्लेयर थी. ये दिल्ली से अपना गेम खेल के हरियाणा आ रही थी, और ट्रेन में कुछ गुंडों ने इनका सामान छीनने के लिए कोशिश की. उस लड़ाई में इनको ट्रेन से बाहर फेंक दिया गया. और जब बाहर फेंक दिया गया तो इनके ऊपर से रात भर में 28 ट्रेन्स, 28 ट्रेनें पास हुई. इनके पूरे शरीर पे इंजरीज थी. इनको जब ले जाया गया 3-4 दिन के बाद हॉस्पिटल में दिल्ली में, इनको जब होश आया तो इनकी टांग जो है वो पूरी काटनी पड़ गई थी, और पूरी बॉडी पे मल्टीपल इंजरीज थी. तो इनके फादर ने इनको पूछा कि अरुणिमा, इनका नाम अरुणिमा सिन्हा है, अरुणिमा अब क्या? बिकॉज यू वेर ए प्लेयर एंड द लाइफ गॉट रूइंड बिकॉज योर लेग्स हैव बीन एम्प्यूटेड. तो अब क्या? तो अरुणिमा ने उस दिन कहा कि अरुणिमा इसी कटे पैर के साथ एक दिन माउंट एवरेस्ट चढ़ के दिखाएगी. And then he got coached, he got mentored by Bachendri Pal, and then she conquered as a first Divyang lady on Mount Everest summit, and later got Padma Puraskar from the President of India. So this is the power of self belief. कहते हैं ना कि जब टूटने लगे हौसले, तो ये याद रखना कि बिना मेहनत के तक तो ताज नहीं मिलते, ढूंढ ही लेते हैं अंधेरों में मंजिल, क्योंकि जुगनू कभी रोशनी के मोहताज नहीं होते. सो वी हैव टू बिलीव इन आवर प्रोफेशन, we have to believe in ourself, and we have to make our students believe in the methodology of teaching the pharmacy profession, the learnings of pharmacy profession. Then I think we can inculcate the feeling that they are the best. And therefore, if we see the interdisciplinary learning prospects in new curriculum, you will see that there are certain spectrum of knowledge beyond pharmaceutical sciences that has been given, even the clinical side, even the regulatory side, even the pharmacy side, and so on. And then artificial intelligence, computational sciences, and then there is an incorporation of obviously pharmacology, pharmacovigilance, chemistry, and all those aspects. And that has been incorporated with the practical training aspects at almost every semester in different one way or the other. So that thing is very innovative in this new curriculum. So that means we have a balanced disciplinary integration. Now in the new curriculum, you will see that earlier it was, distribution of the subjects was not uniform. Now what we have ensured is that the distribution of the uniform distribution within the Sutix, Ecology, Chemistry, and Cognosy is always there in a semester. and also the balanced between theory and practical part. And then we have to also we have also inculcated the real world exposure, integration of hospital training, community pharmacy training, even the project and so on, depending on the interest of the student. So we have an interdisciplinary module where students can learn 3 4 subjects of their choice in one particular area after fifth semester. So that is what I think, very good initiatives taken in new curriculum, and that will impact the pharmacy profession as far as readiness of the students are concerned, or their skills, actual skills are concerned. And one more thing, that B.Pharm graduates are basically, very limited as far as clinical application is concerned. But this new curriculum has a training at hospital, has a training at community pharmacy. So I think that clinical application and understanding of the basics of, see what with our profession, what was the wrong things in last few years. डॉक्टर्स सोसाइटी में कंट्रीब्यूट करते हैं, दे आर विजिबल, देयर कंट्रीब्यूशन इज विजिबल. सीएस कंट्रीब्यूट करते हैं, देयर कंट्रीब्यूशन इज विजिबल. Even the engineers contributing, their contribution is visible. Even the administrative services people are contributing, their contribution is visible. हमारे साथ एज ए फार्मासिस्ट ये हुआ कि वी कैन नॉट रिलेट आवर प्रोफेशन टू द सर्विसेज प्रोवाइडेड टू द सोसाइटी, और वहां हमारे एग्जिस्टेंस पे एक क्वेश्चन खड़ा हो गया. एंड वेन एवर वी टॉक अबाउट द प्रोफेशन, द नॉर्मल पर्सन, द कॉमन मैन always think ourselves as a community pharmacist. So that means we could not correlate all the contributions which we are making to the common man, and that's why the recognition does not come. हमेशा ये कहा जाता है कि जो कैरियर चॉइसेस हैं, ये फ्यूचर को देख के नहीं, सोसाइटी को देख के ड्रिवन होती है. अब आप समझिए कि सोसाइटी में सबसे पहला प्रेफरेंस लोग देते हैं तो वो ये कहते हैं कि आईएएस आईपीएस बनिए, because the reputation of them, although their salary might not be, as much as a professor at government institutes, but the perks they have their, presence in the society. वो पूरे डिस्ट्रिक्ट को जो है कंट्रोल करते हैं. उनका अगर आप देखें कि उनको जो बंगला दिया जाता है वो किस लोकेशन पर और कितना प्राइम होता है, उनको जो सर्विसेज दी जाती है इन टर्म्स ऑफ सर्वेंट्स एंड ऑल, ये सब पर्क्स मिला के सोसाइटी में एक परसेप्शन बनता है कि यस, दिस इज द बेस्ट. Similarly, if you go to CA, if you go to doctor, since they are contributing to the daily life of person, they are respected. But I am afraid to say that this does not belong to majority of the part of our profession, and that is where I think we are lacking. We are not connecting with the society. So we have to understand that whatsoever our students are doing, we have to incorporate the feeling that you are the best. If you believe in yourself, I think anything is possible. कहते हैं कि रख हौसला, वो मंजर भी आएगा, प्यासे कॉल चल के समंदर भी आएगा, थक कर ना बैठ ए मंजिल के मुसाफिर, मंजिल भी मिलेगी और मिलने का मजा भी आएगा. So that is what is needed in our profession, that we all have to believe that we are the best and we are contributing to the society up to our fullest potential. And that also needs to be translated to the society. And that is where I think our role as a teacher is very important. Now we are talking about instilling critical thinking. See, a student has to learn how much number of subjects in 4 years. And if you talk about that, I think more than 70, 60, 70 subjects they are teaching. We are teaching to the students. So we are making them in present curriculum, we are making them master of none, jack of all. And that's where I think students are not, thinking it critically. The innovation culture has been, disabundant, and we have to see this has been done because of the extra pressure we put on the students to learn so many things. So we do not give them the choice to learn according to their will, and that has, halted the critical thinking and innovation culture among students. So let us understand that in very simple language, or in very simple thinking, that what is science or what is critical thinking in it. So my dear friends, science is nothing but it's a way of thinking. हम कैसे चीजों को देखते हैं, कैसे चीजों को समझते हैं, आई थिंक उसी से साइंस बनती है. देर इज नथिंग मच स्पेशल इन इट. वाई आई एम सेइंग इट, क्योंकि हम सब घर में चाय बनाते हैं, और जब हम चाय बनाते हैं तो हम ये देखते हैं कि एक बर्तन है जिसमें चाय पानी सब मिक्स किया हुआ है, हमने दूध पानी पत्ती, और फिर वो हम उसको किसी हीटिंग सोर्स से एनर्जी देते हैं. उसमें इवापोरेशन होता है वाटर का, वो बॉईल होती है, और वो इवापोरेटेड वाटर के ऊपर अगर हम कोई ढक्कन लगा दें तो वो कंडेंस होके वापस गिरता है. ये चाय बनाना हमारी जिंदगी का रूटीन का एक हिस्सा है. अब मैं इसी बात को कोरिलेट करता हूं द वाटर साइकिल विच हैव बीन स्टडीड इन क्लास 8th 9th 10th 11th 12th विथ ऑल ऑफ अस. वाटर साइकिल की जो एक्सप्लेनेशन है, दैट इज exactly similar to what the tea making process is. जैसे चाय में हीटिंग सोर्स है, यहाँ भी हीटिंग सोर्स है. जैसे चाय में एक वेसल है और उसमें वाटर है, यहाँ भी एक ओशन या पॉन्ड है, वहाँ वाटर है. इवापोरेशन होता है, कंडेंसेशन होता है, एंड दैट बिकम्स रेन एंड वाटर कम्स बैक. सो अगर हम इस बात को, चाय बनाने की प्रक्रिया को साइंस से इस तरह रिलेट करते, तो आई थिंक वी कुड हैव अ बेटर अंडरस्टैंडिंग ऑफ साइंस. फ्यू मोर एग्जाम्पल्स. ये फिरकी हम में से कई लोगों ने चलाई होगी मेले में, और जब हम इसको लेके दौड़ते थे बच्चे की तरह तो हमें बहुत खुशी होती थी. बट somebody saw it differently and invented the पवन चक्की. We all have, we all have flown this particular एरोप्लेन्स. हमारी क्लास में कई बच्चे भी कभी कभी उड़ा देते हैं, पर किसी पर्टिकुलर साइंटिस्ट या किसी पर्टिकुलर टीम ने ये सोचा कि अगर ये पेपर का प्लेन उड़ सकता है तो कभी एरोप्लेन भी उड़ पाएगा, एंड दैट बिकम्स ए रियलिटी लेटर ऑन. सिमिलरली हम, जो जो मेरी एज के अराउंड 50 के लोग होंगे इस ग्रुप में, वो ये समझेंगे कि हम भी कभी इस तरह से दो डिब्बियों को जोड़कर एक तार से और दूर जाकर एक दूसरे से बात करते थे. बट नाउ वी हैव स्मार्टफोन्स, and we have in our what we can say stories that Aladdin ka chirag was there and he used to do what we used to say. So nowadays robots are there. So I think, and if we talk about science, or if we talk about pharmacy, हम सब गुलाब जामुन और उसकी चाशनी से वाकिफ हैं, या रसगुल्ले और उसकी चाशनी से, स्वीट शुगर सिरप से वाकिफ हैं. हमारी सिंपल सिरप शायद इसी आइडिया से ओरिजिनेट हुई होगी, या जो मम्मी हॉस्टल में हमें ये शक्करपारे या ये जो कोटेड मैदा के बिस्किट्स वगैरह देती थी, उसी से शायद हमारी फ्लेवर्ड कोटेड टेबलेट्स जो हैं वो ओरिजिनेट हुई होगी. तो दैट इज वेयर आई ऑलवेज से दैट यू हैव टू सी थिंग्स डिफरेंटली. लाइक न्यूटन. न्यूटन कहा जाता है कि सबने देखा कि एप्पल गिर रहा है, लेकिन न्यूटन ने सबसे पहले पूछा व्हाई, एंड देन he gave the famous laws of gravitations. So what we should have is, we should understand that why it is happening, and if we can understand why something is happening, we can come up with a solution very brilliantly with the help of the science. And one more example of it, ये थॉमस अल्वा एडिसन हैं, और इनका ये कहना था कि मैंने जिंदगी में जो कुछ किया, it was fun for me, it was not a pressure on me. So what he did was he invented the bulb, the light electricity bulb. पर उससे पहले ये करीब 10,000 से ज्यादा बार फेल हुए. उससे पहले इनकी लैब में आग लग गई. इनके पास सिर्फ अपनी एक डायरी जिसमें ये नोट्स बनाया करते थे वो बची. तो जो पत्रकार हैं, जो जर्नलिस्ट हैं, वो आए और उन्होंने पूछा कि एडिसन साहब आप कब तक पागलपन करेंगे, अब तो आप समझ जाइए कि आप बल्ब नहीं बना सकते. तो एडिसन ने एक बात कही कि मैं कम से कम 10,000 बार ये जानता हूं कि बल्ब कैसे नहीं बनता. तो डेफिनेट है कि मैं ही एक दिन बल्ब बनाऊंगा, और उन्होंने ये बल्ब बनाया। इसलिए जिंदगी में मेरे दोस्तों, जब हम कुछ भी चीज करते हैं तो ये सिर्फ हार और जीत का खेल नहीं होता। हम हारते कभी नहीं हैं, हम सीखते हैं या जीतते हैं। और ये अनुभव जो हम सीखने के दौरान ले रहे हैं, यही हमारी अगली सफलता का आधार बनते हैं। इसलिए कहा जाता है कि हौसले की तरकश में कोशिशों का तीर जिंदा रखो। हार जाओ जिंदगी में सब कुछ, मगर फिर से जीतने की उम्मीद जिंदा रखो। So that is where I think the culture of innovation, the culture of curiosity, the culture of critical thinking comes. And this is Albert Einstein's quote that हम मैं कुछ भी स्पेशल टैलेंट नहीं रखता, मैं कुछ बहुत बड़ा साइंटिस्ट नहीं हूं। एक चीज है जो मुझे दुनिया में लोगों से अलग करती है, कि मैं पैशनेटली क्यूरियस हूं। मैं उत्सुक हूं उन चीजों को जानने के लिए जिसकी नॉलेज मुझे नहीं है। एंड दैट मेड मी अल्बर्ट आइंस्टाइन। सो दैट इज वेयर आई थिंक, अगर हम कहें कि सबसे बड़ा साइंटिस्ट कौन है, तो मैं हमेशा कहूंगा कि एक बच्चा सबसे बड़ा साइंटिस्ट होता है। क्योंकि उसको ना तो कोई चिंता होती है किसी चीज की, ना उसे ये शर्म होती है कि अगर मैं एक क्वेश्चन पूछूंगा तो मेरा क्या होगा। और जब तक उसे आंसर नहीं मिल जाता, वो अपनी क्वेश्चंस को या वो अपने उस क्यूरियोसिटी को खत्म नहीं होने देता। जो एज के साथ शायद हमारी खत्म हो जाती है, हम शायद थोड़ा हेजिटेट कर जाते हैं, या हम थोड़ा इंट्रोवर्ट हो जाते हैं, या हम सोचते हैं कि अरे हम ये पूछेंगे तो सामने वाला हमें क्या कहेगा। तो आई थिंक बिकॉज ऑफ दैट रीजन our curiosity get killed in society, in our education system. So if we have to understand the future of pharmacy profession, we have to understand that we have to develop a student as a creative thinker, as a a problem solver, as a lifelong learner. And we have to focus our research, we have to focus our innovations towards a very specific objectives. Why I am saying this, चाइना का आप एग्जाम्पल लीजिए। जैसे हमारे यहाँ आयुर्वेदा है, वैसे ही वहाँ मटेरिया मेडिका है। और मटेरिया मेडिका में उनकी फॉर्मूलरी में कई ऐसे फॉर्मूलाज थे जो एंशियंट चाइनीज यूज करते थे फॉर द ट्रीटमेंट ऑफ पीपल। नाउ व्हाट दे हैव डन, they have identified the best of the talents from country in various aspects। और वो उन्होंने आइडेंटिफाई करके एक एक पर्टिकुलर फॉर्मुलेशन के लिए या एक एक पर्टिकुलर थेराप्यूटिक एरिया के लिए उन्होंने नेशनल लेवल पर इंस्टीट्यूट खड़े किए। उन्होंने नेशनल लेवल पर टास्क फोर्स बनाई, और जिसमें केमिस्ट से लेके साइंटिस्ट से लेके फॉर्मुलेशन साइंटिस्ट से लेके क्लिनिकल साइंटिस्ट से लेके सबकी एक टीम बना के उन्हें टास्क दिया गया कि जो फॉर्मुलेशंस उनकी मटेरिया मेडिका में रिपोर्टेड हैं, वो फॉर्मुलेशंस का साइंटिफिक एविडेंसेस वो क्रिएट करें, और एज पर द नीड ऑफ द करंट साइंस उसको वो इस्टेब्लिश करें। एंड दैट हैज गिवन देम majority of the blockbuster drug molecules like artemisinin, like vincristine, like ginseng, and all that, because of their hard work and their dedicated effort in the innovation. So the need is that we have been culturally very rich in our own system of medicine, but we are not integrating, because we cannot break the disciplinary silos. We are concentrating towards one area only. We are not making a teams. We are not collaborating with each other, and we are not yet developing the research and innovation culture which is needed as per the need of the country, as per the need of the global standards are concerned. And therefore we have to provide multiple opportunities to students so that they can contribute what we have not in the last few years. So what is the new opportunities on skill development? The majority of the emphasis of new curriculum is on skill development. And let me tell you why skill is important. आप जो एग्जाम्पल्स मेरे सामने देख रहे हैं, चाय वाला, समोसे वाला, आप सब अपने अपने घरों से बाहर निकलेंगे तो आप इनको पाएंगे। और आप इनमें से कई लोगों को वो भी देखेंगे जो कोई 50,000 महीना, कोई लाख रुपए महीना कमा रहा है। डू दे हैव एनी डिग्री? डू दे हैव यूजी, पीजी, पीएचडी लाइक अस? No, but what do they have? They have the skills. They have the skills which is required to sell themselves as a professional, and that's why they are learning and they are earning. ये जो एग्जाम्पल मैं आपके सामने रख रहा हूँ, स्टीव जॉब्स, मार्क जुकरबर्ग, सचिन तेंदुलकर, मेसी, ये सारे एग्जाम्पल्स आप अब बहुत आश्चर्यचकित हो जाएंगे कि इन सब की कोई भी फॉर्मल एजुकेशन नहीं थी। आई मीन टू से दैट दे आर नॉट फॉर्मली हैविंग डिग्री, यूनिवर्सिटी डिग्रीज। सचिन तेंदुलकर 10th फेल थे। 10th के बाद जब वो अपने फादर के पास गए तो उन्होंने कहा कि मुझे क्रिकेट ही खेलना है, एंड दे वेर ओके विथ इट, एंड देन द ग्रेट सचिन तेंदुलकर इवॉल्व। और बिल गेट्स, मार्क जुकरबर्ग, नो फॉर्मल एजुकेशन, नो यूनिवर्सिटी डिग्री। लिंकन, अब्राहम लिंकन जो यूएस के प्रेसिडेंट, फर्स्ट ब्लैक प्रेसिडेंट बने, they have their, he used to do shoe polish. Messi used to serve tea and drink to the football players in the stadium. And there are so many other examples where skills become made them the greatest. एक एक और चीज जो मैं आपसे शेयर करना चाहता हूँ कि स्किल की इम्पोर्टेंस क्यों जरूरी है, या हम ये कह लें कि क्यों, अगर हम जिस चीज को सीखने में इंजॉय करते हैं तो वो चीज जो है हमें लाइफ लॉन्ग याद रहती है। अ, हम साइकिलिंग सीखते हैं बचपन में, हम स्विमिंग सीखते हैं बचपन में, और उसके 50 साल 25 साल बाद भी कोई हमें साइकिल दे दे या हमें नदी में जाना पड़ जाए तो हम तैर सकते हैं या साइकिल चला सकते हैं। क्या कभी आपने सोचा कि एक बच्चा जो फर्स्ट सेमेस्टर पढ़ के जाता है, वो फर्स्ट सेमेस्टर का पढ़ा हुआ उसको सेकंड में याद नहीं होता, सेकंड का पढ़ा हुआ उसको फोर्थ में याद नहीं होता, या पूरे 4 साल उसको पढ़ने के बाद भी बहुत सारी चीजें ऐसी जो उसको याद नहीं होती? बिकॉज द इन्वायरमेंट एंड द एजुकेशन सिस्टम इज broadly depending on रट्टोफाइंग द थिंग्स, ऑन रॉट मेमोरी। हम बस रटें, हम उसे लिखें एग्जाम में, हम नंबर ले आए। और अब हम देख रहे हैं कि एक ट्रेंड चल रहा है कि सीजीपीए 8.5, 9, 9.5, 9.8 एंड समथिंग ऑन। बट इफ यू ask student something basic, they could not answer it majority of the time. So that's where we have to understand that there is a need of understanding the fact that you should harness your skill. You should understand you are great at what. कहते हैं कि परिंदों को मिलेगी मंजिल यकीनन, ये फैले हुए उनके पर बोलते हैं, वही रहते हैं खामोश अक्सर जमाने में जिनके हुनर बोलते हैं। तो ये जो प्रैक्टिस है, ये प्रैक्टिस आपको हमें एज ए टीचर स्टेब्लिश करनी पड़ेगी। एज ए स्टूडेंट उनके अंदर ये चीज आइडेंटिफाई करके उनको हार्नेस करना पड़ेगा। आई थिंक देन ओनली वी कैन हैव ए ग्रेट इंडिविजुअल इन मेकिंग। सचिन तेंदुलकर या हम सब कोई भी डिसीजन लेते हैं वो राइट डिसीजन कहलाता है अगर हम उसको राइट एफर्ट करते हैं, उसमें हार्ड वर्क करते हैं। एंड we have to make, the decisions are not right, we have to make the decision right by our doings. And that's why I think it is very important to understand that we are competing with ourselves, we have to improve it every day. The curriculum is evolving, the pace of the pharmacy profession is going very fast. After COVID-19, a lot of things in the world have been changed. The perception of the people towards pharmacy people has been changed, and therefore we have to encash that if we have the knowledge। ये आपके सामने एक एग्जाम्पल मैं ले रहा हूं कि जब आप आंखों का चेकअप कराने जाते हैं तो आपके सामने कुछ हिंदी या बंगाली या आपकी लैंग्वेज में कुछ वर्ड्स कहे जाते हैं और आप पढ़िए, और आप उनको पढ़ते हैं, उस बेस पे आपकी जो आईसाइट है उसको हम मेजर करता है डॉक्टर। लेकिन सपोज आप सोचिए कि राइट हैंड साइड पे जो लिखा हुआ है मैंडेरिन लैंग्वेज में, अगर वो आपको पढ़ने को वहां दे दिया जाए तो क्या आप इसको पढ़ पाएंगे? तो अगर आप इसको नहीं पढ़ पाएंगे तो क्या आप मूर्ख हैं या आपकी आंखें काम नहीं कर रही? ऐसा नहीं है। सिंस वी डू नॉट हैव द नॉलेज, वी कैन नॉट अंडरस्टैंड एनीथिंग। So that's why I'm telling that not marks, knowledge is the key to understand the future, to understand the development of the future. And if we understood as a teacher, I think we can inculcate this feeling in our students that knowledge and skill is important, not the marks. And one more example of it, if you talk about, all nipers, how many nipers are there and how they are contributing? They are excellent. They have the cream of the students. I am not, taking their credits away. The students who are contributing from Niper or from IIT or from IIM, yes, they are contributing largest to the best of the potential. But how many of them? 18,000 इंजीनियर हर साल आईआईटी में जा सकते हैं, या आईआईएम में कुछ बच्चे जा सकते हैं, कुछ बच्चे नाइपर में जा सकते हैं, बट द कंट्री इज रन बाय स्टूडेंट्स पासिंग फ्रॉम भारत टेक्नोलॉजी, पासिंग फ्रॉम इंस्टीट्यूशंस लाइक अस. They are running this country, and that thing we need to incorporate in the society, in the students, this belief that we are the backbone of the pharmacy profession and we are contributing up to the fullest potential. Then only we can inculcate this feeling of proudness towards the profession, and then we can have the culture of taking pharmacy as a pride profession in career aspects. So what PCI is doing as far as skill based curriculum is concerned, after COVID-19 insights, we need a modernization. So we are transitioning towards the traditional uh, theory high curriculum from a practical high curriculum. And then we are producing the graduates with versatile competency as far as the global context is concerned. And therefore, in new curriculum, there are two mandatory internship, one in industry and manufacturing sector and another in clinical and community pharmacy has been inculcated in new syllabi. So, and then there are new technologies like artificial intelligence, modern food chemistries, computational languages, and there are other so many robotics and medtech devices and all other aspects and subjects have been incorporated so that we can develop a overall fully grown student, or fully what we can say as per the global standards, we can develop our industry ready pharmacist in future with the new curriculum. Yes, all of us are doing very great. I am also saying very great things towards the new education curriculum by PCI. But what are the takeaways? Takeaway is that we have to have competency based assessment. We have to have understand what are the outcomes we need. We have to understand that what are the role of experimental and skill based learning to the students, what are the role of collaborative environment. Now you cannot, everybody in the in the country is saying artificial intelligence पे इतना आपने एक एक सब्जेक्ट हर सेमेस्टर में नए क्यूरिकुलम में इंट्रोड्यूस कर दिया है. How our teachers will teach, we should have collaboration. I understand we cannot learn everything, but we should understand that AI is coming like a big thing. And if we on, कहा जा रहा है कि एआई लोगों को रिप्लेस कर देगी, बट मेरा कहना है कि एआई उन लोगों को रिप्लेस करेगी जिनको एआई नहीं आता है. अगर आपको एआई आता है, यू विल बी वेरी मच रिक्वायर्ड इन द नेक्स्ट फ्यू years. So that's where seeing this, forecasting this, the future need of the profession, AI has been integrated in the syllabus like anything. So we can collaborate with computer science professional. We can collaborate even earlier also. We collaborated with maths people. We collaborated with computational people, and so on. So similar kind of collaboration can be given in multi-institutional setup, in uni-institutional setup. Also, this kind of teachers can be shared. But saying all these things, again the onus comes on all of us. Being a teacher, it is our prime responsibility to carry the burden of the education system on our shoulder. मैं ये इसलिए कह रहा हूं कि मैं हमेशा कहता हूं कि कोई भी स्कूल या कॉलेज जो है वो किसी बिल्डिंग या लैब या इंस्ट्रूमेंट से नहीं बनता. स्कूल और कॉलेज बनता है टीचर्स से, स्कूल और कॉलेज बनता है टीचर स्टूडेंट रिलेशनशिप से। और ये भी कहा जाता है कि अगर आप एक सिविल इंजीनियर गलत बन जाएगा तो आई थिंक वो एक दो पुल गलत हो जाएंगे, वो टूट जाएंगे, कुछ लोगों की डेथ हो जाएगी। एक डॉक्टर गलत हो जाएगा तो कुछ लोग ऑपरेशन टेबल पर शायद मर जाएं। एक सीए अगर गलत हो जाएगा तो दो चार कंपनियों की जो बैलेंस शीट है वो शायद फॉल्टी हो और लोग उससे धोखा खा जाएं। लेकिन अगर एक टीचर गलत हो जाएगा तो अगली पूरी एक प्रोफेशन, एक पूरी पीढ़ी को वो खत्म कर देगा। और इसलिए टीचर का रोल जो है वो सबसे बड़ा है। और हम ये भी कहते हैं कि टीचर का रोल इसलिए भी बड़ा है कि आप अगर अपने एरिया में भी देखें, सिंस यू बिलोंग टू द एरिया वेयर द नॉलेज कम्स फर्स्ट, बंगाल, और वो जो आपका जो कल्चरल हेरिटेज है, दैट हेरिटेज इज ऑफ सोशल एस्पेक्ट्स, दैट हेरिटेज ऑफ नॉलेज इज देयर। आपकी आपकी जो लिटरेरी जो आपकी अवेयरनेस है वो सबसे बड़ी है। सो आप अगर देखें कि आपकी आपके एरिया के पांच सबसे बड़े सेठों के नाम क्या हैं जो बहुत पैसे वाले हैं, तो आपको शायद एक दो नाम याद आएंगे। लेकिन आप अपने एरिया में से देखें कि नॉलेजेबल लोगों के नाम कौन कौन से हैं, या पांच गुरु शिष्यों के नाम कौन से हैं, तो आपके पास ऐसे पांच क्या हजारों एग्जाम्पल आ जाएंगे। चाणक्य, चंद्रगुप्त, अर्जुन द्रोणाचार्य, रविंद्रनाथ टैगोर, and the beautiful. I used to be there at the place where Rabindranath Da was there, and Shanti, this their university now, Shanti Niketan, has been established. So when you go to such places, you can see what heritage we had as a teacher. And now मैं हमेशा कहता हूं कि 100 साल बाद आपको कोई याद नहीं रखेगा कि आपने कौन से कपड़े पहनते थे, या आप कौन सी गाड़ी में आते थे, या आप कौन से कौन कौन सी बिल्डिंग में रहते थे, या आप कितने स्टाइलिश थे। 100 साल बाद अगर आपको जिंदा रहना है, कहते हैं ना कि मौत से बचने की एक ही तरकीब है दोस्तों, कि तुम अपने बच्चों की सोच में जिंदा रहो। तो एक टीचर जो है उसके पास ये एबिलिटी है कि वो अपनी बच्चों में, उनकी सोच में, उनकी सक्सेस में जिंदा रह सकता है। और इसलिए मैं हमेशा कहता हूं कि मैं जानता हूं कि बहुत सारी डिफिकल्टीज हैं। अब अभी हमने यहाँ 500 टीचर्स का सर्वे किया, फार्मेसी टीचर्स का, और हमने देखा कि 77% ऑफ देम आर फीलिंग स्ट्रेस्ड, मेजोरिटी इन द प्राइवेट सेटअप। 68% आर कैन नॉट कोप अप विद द वर्कलोड डिमांड्स। 84% felt that time constant is there, and then 70% thinks that there is a politics in the uh, in the institute, and also there is a shortage of faculty, and then there is a very big gap. I cannot deny this, everybody is suffering from this, but the thing is, मैं हमेशा कहता हूं कि जैसे शाहरुख खान ने अपनी वो चक दे इंडिया में कहा था कि वो 90 मिनट, तो मैं हमेशा कहता हूँ टीचर से कि आपके ऊपर बहुत स्ट्रेस है, आप बहुत घर की परेशानी है, आपके ऊपर कॉलेज की परेशानी है, आपके ऊपर वर्कलोड बहुत है, लेकिन जब आप क्लास में जाएं, वो 50-60 मिनट्स आप ओन करें, आप अपना बेस्ट उसमें दे के आए। और एक टीचर के नाते मैं हमेशा ये मानता हूं, अभी भी मैं, इवन दो आई एम प्रोफेसर सिंस लास्ट 10 years in a government institution, I always take class more than 20 hours per week to UG and PG students. Why? Because that is our forte. That is where our happiness resides. एक दिन जब आप क्लास लेके आते हैं, उसके बाद की जो खुशी आपके चेहरे पे होती है, उससे बड़ी खुशी आपको कोई प्राइज, कोई अवार्ड मिल जाए, उससे ज्यादा नहीं हो सकती। तो मैं हमेशा ये कहता हूं कि एक टीचर का जो रोल है, वो टीचर का रोल है फैसिलिटेटर का। पहले इंफॉर्मेशन अवेलेबल नहीं थी, अब इंटरनेट के जमाने में इंफॉर्मेशन बहुत है। हमें फैसिलिटेटर बनना है, हमें ये समझाना है बच्चे को कि वो अपने ऊपर विश्वास रखे, वो लगातार ग्रोथ, कंटिन्यूअस डेवलपमेंट की तरफ ध्यान दे। और हमें कहीं ना कहीं शिक्षक से गुरु बनने की तरफ जाना पड़ेगा। हमारी ट्रेडिशंस रही हैं पंजाब में, गुरु ग्रंथ साहब और गुरु साहब की परंपरा है। बंगाल ऑलरेडी इसमें सबसे रिच है, आई कैन से वेरी प्राउडली। सो दैट मीन्स दैट this initiative of gurus, the transformation from teacher to guru, कहते हैं ना कि शिक्षक क्या करता है, तो मैं हमेशा कहता हूं कि सुंदर सुर सजाने का साज बनाता है, नौसिखिए परिंदे को बाज बनाता है, चुपचाप सुनता है शिकायतें सबकी, तब दुनिया बदलने की आवाज बनाता है, समंदर तो परखता है हौसले कश्तियों के, अरे शिक्षक तो डूबती कश्तियों से जहाज बनाता है, और बनाना चाहे कोई चांद पर बुर्ज खलीफा, अरे शिक्षक तो कच्ची ईंटों से ताज बनाता है। सो वी हैड दिस लेगेसी of being producing the greatest of the teacher, producing the best of the holistic education system in our ancient times. So now we have to be, not being a teacher, but we have to understand that हमें गुरु बनना है, हमें मेंटर बनना है, हमें गाइड बनना है, हमें इनोवेटर बनना है। तब जाके, और ये तब पॉसिबल हो जाएगा जब हम इमोशनल सपोर्ट देंगे बच्चों को। वी कैन बी serve as emotional anchors to the students. They have the energy, they have the information, they can do wonders if you lend a hand of support to them. And that's where I think holistic education concept is coming. I know you are facing, being a teacher, we are facing a lot of problems. And for that, I should say that उसूलों पर आंच आए तो टकराना जरूरी है, जिंदा हैं तो जिंदा नजर आना जरूरी है। तो इसलिए मैं हमेशा कहता हूं कि ठीक है, परेशानियां हैं, लेकिन जब हम क्लास में जाएं, हम अपना बेस्ट दे के आए। और एक चीज मेरे दोस्तों बड़ी इंपॉर्टेंट है कि जो जो ये टाइम आ रहा है, जो चेंजेस आ रहे हैं सोसाइटी में, जो चेंजेस एजुकेशन सिस्टम में आ रहे हैं, जो चेंजेस नई जनरेशन जेन जी जिसको हम कह रहे हैं, उनकी थिंकिंग प्रोसेस में आ रहे हैं, रिस्पेक्ट हैज टू बी अर्नड। रिस्पेक्ट सिर्फ आपके पद से या आपके डेजिग्नेशन से नहीं आ रही है। अगर आप उनकी लाइफ में कुछ कंट्रीब्यूट करेंगे, तभी वो रिस्पेक्ट आ रही है, और वो रिस्पेक्ट आएगी। कहते हैं कि सोसाइटी में कैसे चेंज एक टीचर ला सकता है, तो मैं हमेशा कहता हूं कि एजुकेशन जो है वो इंटेलिजेंशिया, जो वर्ड है इंटेलिजेंस, वो आया है नॉट ओनली फ्रॉम डिराइविंग द इंफॉर्मेशन, बट टू अंडरस्टैंड एंड अडॉप्ट द environment एंड करेक्टली यूटिलाइजिंग योर थॉट एंड रीजन। दैट मीन्स आपके पास इंफॉर्मेशन चाहे जितनी हो, जब तक आप अपने सराउंडिंग को, अपने आसपास वाले को, अपने अपनी सोसाइटी को नहीं समझ के उसको सही यूज करते, आपका डिसीजन सही नहीं होगा। और इसलिए मैं कहता हूं कि वन इज इंफॉर्मेटिव इंटेलिजेंस, जहां इंफॉर्मेशन आपके पास है, आप उसको लिखिए, पेपर में नंबर आ जाएंगे। बट इफ यू आर मेकिंग डिसीजंस ऑन योर साइड, that is cognitive intelligence. If you are then moving towards social setup, इमोटिव इंटेलिजेंस। सो दैट मीन्स कि सिर्फ बुक्स तक लिमिट नहीं रखना है बच्चों को। एंड दैट इज द मोटिव ऑफ न्यू करिकुलम ऑफ पीसीआई। कहते हैं कि धूप में निकलो, घटाओं में नहा कर देखो, जिंदगी क्या है किताबों से बाहर आकर देखो। तो दैट इज वेयर आई थिंक हम सबको ये सोचना चाहिए कि सोशल एस्पेक्ट्स, होलिस्टिक एस्पेक्ट, हम एक दूसरे का साथ दें। बीइंग टीचर ऑल्सो, वी शुड अंडरस्टैंड एंड कोऑपरेट एवरीवन अराउंड अस। बीइंग a learner, being a motivator, we also inculcate the feeling that society first should be there. एंड इसीलिए मेरी बहुत फेवरेट सॉन्ग की ये लाइंस है कि किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है। सो व्हाट आर द चैलेंजेस वी आर फेसिंग? रिसोर्स कांस्टेंट, हम बहुत सारे सब्जेक्ट्स ले आएंगे, लेकिन टीचर्स कैसे लाएंगे? हमें उनको फैकल्टी डेवलपमेंट प्रोग्राम्स कराने पड़ेंगे, जो पीसीआई ऑलरेडी प्लान कर रही है। रेगुलेटरी कॉम्प्लेक्सिटी, आप समझते हैं कि कैसे अप्रूवल और एक्रेडिटेशन प्रोसेस में इंस्पेक्टर्स का रोल होता है, क्या वो सही हो रहा है या नहीं, ये कॉम्प्लेक्सिटी कई जगह है। रूरल और अर्बन और सेमी अर्बन इंस्टीट्यूशंस में फैकल्टी की रिक्वायरमेंट, इंटरनेट कनेक्टिविटी की रिक्वायरमेंट, और बहुत सारी चीजें एक अभी भी चैलेंजेस बना हुआ है। क्यूरिकुलम का एब्रप्ट ओवरहॉल अगर हम करते हैं तो हमें टीचर्स को उसके हिसाब से ट्रेन करना पड़ेगा, और हमारे असेसमेंट रिफॉर्म्स में भी वो चीजें लेकर आनी होगी। सो ये चैलेंजेस हैं, ये चैलेंजेस आएंगे, बट विद द पेस ऑफ phased implementation, teachers training programs like what we are doing today, FDP, we have to understand new things, public private partnership and quality monitoring in a better way. I think this can be a road ahead for new PCI curriculum. और कैसे सक्सेस होगी? छोटी छोटी चीजों से सक्सेस होगी। अब जैसे हम एक एग्जांपल देख रहे हैं कि 0.99 का 365 टाइम्स और 1.01 का 365 टाइम्स, दोनों में कम से कम 1000 गुना से ज्यादा का फर्क है। तो चैलेंजेस आएंगे, कहते हैं कि मुश्किलों से भाग जाना आसान होता है, हर पहलू जिंदगी का इम्तिहान होता है, डरने वालों को मिलता नहीं कुछ जिंदगी में, पर लड़ने वालों के कदमों में जहान होता है। तो टीचर्स, माय डियर टीचर्स, वी हैव टू फाइट इट एंड वी हैव टू अंडरस्टैंड दैट विथ एवरी इम्प्रूवमेंट we will be a better person, we will be a better teacher and we will be a better contributor to the profession. आप देखिए जोकोविच को आप सब जानते होंगे, बिकॉज बंगाल इज ए स्पोर्ट्स लविंग पर्सन। तो यू कैन सी दैट मैच पॉइंट्स 49% अगर वो जीतते थे तो उनकी रैंक 49 थी। जब 52 जीतने लगे तो उनकी रैंक, सॉरी 49 में उनकी रैंक 600 प्लस थी, 52 जीतने लगे तो थर्ड रैंक हो गई, और स्लाइटली वेरिएशन जब उन्होंने किया तो उनका जो रैंक है वो नंबर 1 हो गया। मतलब स्लाइट इंप्रूवमेंट से यू कैन बी अमंग द बेस्ट। और इसलिए जब हम सब मिल जाएंगे, तो ये हाथी अगर पेड़ गिरा देता तो ये सब एनिमल्स उस पर चढ़ जाते और जीत जाते और टॉपर बन जाते। तो जब हम सब मिल जाएंगे तो ये न्यू क्यूरिकुलम भी हम इफेक्टिवली इम्प्लीमेंट कर देंगे, और हम बेस्ट ऑफ द फार्मासिस्ट प्रोफेशनल्स, जो जो नीड ऑफ द आवर है, वो ट्रांसफॉर्मेटिव स्टेप को सही प्रूव करेंगे, और फ्यूचर रेडी फार्मासिस्ट वी कैन जनरेट। सो थैंक यू सो मच। At the end, I would like to say that everything happens in a slow pace. धीरे धीरे रे मना, धीरे सब कुछ होए, माली सींचे 100 घड़ा, ऋतु आए फल होए। तो ठीक है, हम सब मिलकर जब इसके साथ चलेंगे, इस क्यूरिकुलम को इम्प्लीमेंट करेंगे, परेशानियां आएंगी, बट हम ये अश्योर्ड हैं कि जिस तरह से टीचर्स ने पहले भी कंट्रीब्यूट किया है, टीचर्स ही इस न्यू क्यूरिकुलम और प्रोफेशन को वापस टुवर्ड्स ए ग्रेटर हैंड साइड ले जाएंगे, टुवर्ड्स द पिनेकल ऑफ द प्रोफेशन ले जाएंगे। एंड वी ऑल हैव टू understand that it's a contributory effort, it's a collaborative effort. So I think with these words, I think thank you so much for this wonderful session. I think I am on time, within 1 hour. 1 hour was given to me to by Dr. Amlan, so I am within the time. So
Thank you, sir.
it's a teacher's responsibility to be on time so that next teacher can come in on time. So thank you so much for everything. Thank you so much for inviting me. And if anybody has any question, I am open for it. And I think my numbers are there with Viplav. He has been always kind enough. He has always been cooperating. And my dear friends, with a neutral perception, I must say, and I am not appreciating because I am invited by Bharat Technology. I am appreciating by as a pharmacy professional, as a teacher who is seeing the progress of the institution since last 25 years. I am very sure that Bharat Technology is moving towards one of the greatest institute, becoming one of the greatest institution in that particular area, and my contribution and my collaboration with this institute will remain forever. Thank you so much.
Thank you, sir. Thank you. On behalf of Bharat Technology, I want to extend my gratitude for sharing such an insightful session. Now it's time for some questions. So I request all the participants, the platform is open now. You can ask questions to our respected Professor Ashish Baldi, sir. Sir, few questions are there on the chat box also. So first question is it possible to introduce mathematics compulsory subject in this upcoming syllabus, and how the industry oriented collaborative research can be made stronger?
As far as mathematics is concerned, हम सब ये फील करते थे कि मैथमेटिक्स वाज द सब्जेक्ट जहाँ बच्चे को सबसे ज्यादा डिफिकल्टी आती है हमारे यहाँ पे। तो पहले पीसीआई ने अभी भी इसको इंस्टीट्यूट लेवल एग्जाम में कन्वर्ट कर दिया जहाँ पेपर इंस्टीट्यूट से बन के आते हैं। बट इन दिस न्यू curriculum, traditional maths has been replaced with the softwares which we use in pharmaceutical industry like statistics softwares and other softwares which we are actually using design expert software, we are actually using biostate software. So the emphasis of maths has been increased in new syllabus towards the practical aspects and not learning the differential and integral and all that. बिकॉज हम सब ने ये फील किया है, हमने सब ने पढ़ा है वो डिफरेंशियल इंटीग्रल के कैलकुलेशंस, वो चीजें हमने कभी जिंदगी में पढ़ी नहीं, कहीं काम नहीं आई। तो अब जो मैथ्स आ रही है नए सिलेबस में वो कन्वेंशनल मैथमेटिक्स नहीं है। मैथमेटिक्स के जहां जहां सॉफ्टवेयर्स अवेलेबल है, because when you have software, then why to go towards learning how to calculate median, how to calculate mode and all that? You learn the software and you do it. What is the necessity of understanding what are the involvements into it? So that thing has to be taken care, that has been taken care in this particular syllabus. The second thing is interdisciplinary education, why it is required. See, we have a horizon of job opportunities available everywhere, no doubt into it. Students are getting absorbed. That is also okay. But now the scenario is changing very fast. Say medtech devices. Now the medtech device development, pharmacist is needed, a engineer is needed, computational professional is needed, and also certain other medical or marketing professionals are needed. So that means you have to understand interdisciplinary aspects of discoveries. So then this part interdiscipline, this is one example. Another example is if you go to pharmacovigilance, you need clinical understanding, you need biochemistry understanding, you need computational understanding of generating report, you need understanding of medical writing, you need understanding of IPRs and other regulatory processes. So that means again it is becoming interdisciplinary. Now go to artificial intelligence. We are using artificial intelligence in diagnosis. We are using artificial intelligence in remote access. We are using artificial, even in my lab, we have got sponsored 3 projects from various industries, and we are doing artificial intelligence for authentication of herbal drugs. अब हर्बल ड्रग्स की अगर मैं हम बात करते हैं, जो पुराने वेद आचार्य हैं उनको पता है कि ये ड्रग कौन सी है, कहाँ काम आएगी, हमें नहीं पता। तो हम तो क्यों ना टेक्नोलॉजी का यूज करें, एक फोटो खींचे और वो बताए कि क्या कौन सी हर्ब है। सो ये एडवांसेस आ रहे हैं, वी कुड सी इट। एंड इफ वी आर नॉट नोकिया एक बहुत बड़ी कंपनी थी, वो आउटडेटेड क्यों हुई? बिकॉज उसने डिजिटल जो चेंजेस आ रहे थे स्मार्ट फोन के, वो उसको अडॉप्ट नहीं किया। जेरोक्स जो 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 हम जेरोक्स कंपनी फोटोकॉपी में होती थी, उसने एडोब और फोटोशॉप के प्रोस्पेक्ट्स को नहीं उन्होंने एक्सेप्ट किया, दे गॉट वेनिश्ड। सो इफ टाइमली हम उन चीजों को समझ कर अगर हम आगे नहीं बढ़ते हैं तो देर विल बी ए प्रॉब्लम इन इन आवर एग्जिस्टेंस। सो आई थिंक दैट्स वेयर आई थिंक वन ऑफ द interdisciplinary aspect is very much necessary. Collaborative research, why it is important? Uh, I am an expert of pharmaceutics. That does not make me an expert of biopharmaceutics. That does not make me an expert of pharmacology. That does not make me an expert of clinical pharmacology. But now इट इज नॉट लाइक दैट कि आप एक फॉर्मुलेशन बनाएं, उसका ऑप्टिमाइजेशन करें और थीसिस पूरी कर दें। अब जो डिमांड आ रही है इंडस्ट्री की, या अब जो डिमांड टाइम की आ रही है, वो ये आ रही है कि आप ट्रांसलेशन करो प्रोडक्ट में, आप स्केल अप करके उसको लेके आइए, आप उसको क्लिनिकल एविडेंसेस लेके आइए। तो वो जब तक आपके साथ कोई डॉक्टर इनकॉर्पोरेट नहीं होगा, जब तक आपके साथ कोई इंजीनियर इनकॉर्पोरेट नहीं होगा, तब तक आप स्केल अप और उसके क्लिनिकल और उसके प्री क्लिनिकल रेगुलेटरी एस्पेक्ट को आप समझ नहीं पाएंगे। तो यू कैन नॉट बी एन ए मास्टर ऑफ एवरीथिंग। तो कोलैबोरेशन जब तक आप नहीं करते हैं, आई थिंक यूर ग्रोथ इज लिमिटेड. सो दैट्स वेयर द क्वालिटी कम्स फ्रॉम कोलैबोरेशन. एंड वन मोर फैक्ट, जितने इंस्टीट्यूशन 5,000 प्लस 15,000 प्लस जितने इंस्टीट्यूशन हैं इंडिया में फार्मेसी के, हाउ मेनी ऑफ देम रियली इक्विप्ड फॉर ए गुड रिसर्च? मैं कोई नंबर नहीं देना चाहूंगा, मैं किसी को नहीं, आप जितने इंस्टीट्यूट से आप लोग हैं, आप खुद समझिए. तो हमें अच्छी जगह जाके काम करना पड़ेगा, हमारे बच्चों को भेज के उनसे काम करवाना पड़ेगा. ये जो इंफ्रास्ट्रक्चर है ये बहुत इजीली डेवलप नहीं होगा. अच्छे इंस्टीट्यूशन जिनके इंटेंशन अच्छे हैं वो अच्छा धीरे धीरे डेवलप करेंगे. लेकिन कई लिमिटेशंस आ जाती हैं जहां पे मैनेजमेंट नहीं चाहता कि इतना कोई कल्चर डेवलप हो. बहुत हार्श फैक्ट्स में आपको बोल रहा हूं. तो वहां टीचर, अगर एक अच्छा टीचर वहां चला गया तो वो फ्रस्ट्रेट हो जाएगा. तो ये नहीं है कि जो अच्छे कॉलेजेस में बैठे हैं या जो अच्छे गवर्नमेंट इंस्टीट्यूशंस, गवर्नमेंट लैब्स, सीएसआई लैब्स में बैठे हैं वही ग्रेट साइंटिस्ट हैं. ग्रेट साइंटिस्ट कई प्राइवेट कॉलेजेस में होंगे, बट उनको चूंकि अपॉर्चुनिटी अगर सही नहीं मिलेगी तो वो कैसे ग्रो करेंगे, कैसे कंट्रीब्यूट करेंगे? तो ये सब चीजें पॉसिबल है कि हम कोलैबोरेट करें. हम हाँ, हम अपनी चीजों को किसी के साथ मिलकर करें. तो आई थिंक दैट कैन बी ए सॉल्यूशन. और सबका अपना अपना एक सेटिस्फेक्शन होता है, उस सेटिस्फेक्शन को जब तक इंसान अचीव नहीं करता तब तक उसका आउटपुट जो है वो उतना अच्छा नहीं आता. तो उस सेटिस्फेक्शन के लिए, उस इन्वायरमेंट के लिए, कोई टीचर है उसको पढ़ाने में मजा आता है, कोई टीचर है उसको रिसर्च पेपर्स चाहिए. मैनेजमेंट को लेकिन सब कुछ चाहिए. मैनेजमेंट को ये भी चाहिए कि आप डॉक्यूमेंटेशन भी करो, मैनेजमेंट को ये भी चाहिए कि आप नैक भी कराओ, मैनेजमेंट को ये भी चाहिए आप एनबीए कराओ, मैनेजमेंट को चाहिए आप पेपर भी लिखो, मैनेजमेंट को चाहिए बच्चे को पढ़ाओ भी अच्छा. तो कहीं ना कहीं मल्टीटास्किंग हम लोगों को होना पड़ रहा है. और वो जब तक हम इंटरडिसिप्लिनरी कोलैबोरेशंस नहीं करेंगे, एक दूसरे से नहीं सीखेंगे, तब तक. और ये सब सब जो खेल है ये टीम का है. एक इंस्टीट्यूशन ग्रेट एक इंडिविजुअल, दो इंडिविजुअल से नहीं बनता. एक इंस्टीट्यूशन बड़ा बनता है, एक टीम अच्छी होगी तो वो बनता है. तो दैट इज वेयर आई थिंक आवर ओन. मैंने कहा ना कि सब यूनिक है. तो वो जो इंस्टीट्यूशन बड़ा इसलिए बन जाएगा क्योंकि उसने उस आदमी को टीचिंग दे रखी है जिसको टीचिंग का शौक है. उस आदमी को रिसर्च दे रखी है जिसको रिसर्च का शौक है. उस आदमी को डॉक्यूमेंटेशन दे रखा है जिसको कागजों से खेलने का शौक है. अगर आपने सही आदमी को सही काम दे रखा है आपका आउटपुट बढ़ जाएगा. अगर आपने गलत आदमी को गलत काम दे दिया वो काम कभी होगा नहीं, आप परेशान रहेंगे. तो सिंपल सी गेम है कि आप भी जैसे बच्चों के इंडिविजुअल्स को समझ रहे हैं आप, वैसे ही टीचर्स अपने प्रिंसिपल्स अपनी टीम को समझे और उनसे यही एक्सपेक्ट करें. एक अच्छा टीचर है वो जरूरी नहीं वो 10 पेपर लिख देगा. एक अच्छा पेपर लिखने वाला है वो साल के 25 पेपर भी लिख देगा. तो जिसका जो काम है उससे वो करवाइए, आपके टारगेट पूरे करिए. दैट्स वेयर आई थिंक एवरीबडी विल फिट इन. तो सब कोई सब कुछ नहीं हो सकता. लेकिन जो कुछ जो कर सकता है वो टीम को कंट्रीब्यूट करे और इंस्टीट्यूट इसी तरह से आगे बढ़ते हैं.
Thank you, sir. And sir, another question from Dr. Sanchita Das: is there any importance of continuous assessment in outcome-based education?
Yes, 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 yes. Now the system will change. We are largely depend on end semester examination in the old curriculum. Now there will be provision for assignments, quizzes, internship, training, and practical aspects. एंड इवन सम ऑफ द प्रैक्टिकल्स जहाँ पर थ्योरी और प्रैक्टिकल एस्पेक्ट्स को साथ में क्लब किया गया है, जहाँ बच्चे को जैसी नीड है. तो बहुत सारे चेंजेस आप देखेंगे. थोड़ा इजी हो जाइए, कोई इतना बहुत चेंज कुछ नहीं होगा. जो होगा वो टीचर्स कोप अप कर पाएंगे बड़े आसानी से. आपकी जो जीन्स हैं वो एडॉप्टिव जीन्स हैं. टीचर एक सोसाइटी का वो पिलर है जो हमेशा समय के साथ एडॉप्ट होता है. और आप बहुत सारे चैलेंजेस देख के भी खड़े होते हैं और क्लास में डिलीवर करते हैं. तो कुछ जो कुछ भी चेंज आएगा आपसे बड़ा नहीं होगा, आप उनसे बड़े होंगे.
Okay, sir. There is no more questions in the chat box. So thank you, sir, for your insightful sessions and the practical-oriented deliberations. Whatever you have made today, it's give immense impact in our upcoming sessions also. And thank you, sir. I want like to tell the technical team. So please share the token of appreciation to Professor Dr. Ashish Baldi sir. Says this is a small token of appreciation from our
Thank
side.
you. Thank you so much. Thank you, Amlan, and convey my regards and blessings to Viplav. And
Yes,
it has been a wonderful opportunity for me also to be a part of this because a teacher likes to reach to everybody. तो आपने ये अपॉर्चुनिटी दी कि मैं पहुंच पाया, कई नाम मेरे पहचान के लोग दिख रहे हैं, तो अच्छा लगता है जब आप लोगों से मिलते हैं. थैंक यू सो मच.
thank you, sir. Thank you. So by this, we can end the day five first session. So I will request the participants to please stay tuned. We will take a break for 10 minutes, and then we again come back with our second session today. So stay tuned for 10 minutes. We are taking a break for 10 minutes.
I am okay if I leave. Like,
Yes, sir. Yes, sir. Yes, sir.
yeah. Thank you. Thank you. Thank you so
Okay,
much.
sir. Okay. So, my dear participants, we will begin our second session from 11:30 onwards. So please join at 11:30. So again, good morning, everyone. Today we will going to start our day 5, session 2 faculty development program, which has been organized by Bharat Technology on theme strengthening academic excellence, FDP for the outcome-based new B.Pharm syllabus. Now on the session 2 program, we have with us an eminent academician as well as a thoughtful leader, Professor Dr. Krishnan Anand sir. Welcome you, sir, in our FDP program. Now, before going to start the second session of day 5 program, I want to introduce our speaker, Dr. Krishnan Anand sir. Dr. Krishnan Anand is a researcher in the field of precision medicine and integrated nanodiagnostic, currently associated with the Precision Medicine and Integrated Nanodiagnostics (PMIND) Research Laboratory, School of Pathology, Faculty of Health Sciences, University of Free States UFS, Bloemfontein, South Africa. His research focuses on the interdisciplinary integration of nanotechnology, molecular diagnostics, and biomedical sciences to develop advanced diagnostic platforms and precision-based healthcare solutions. Dr. Anand's scientific interest includes nanobiomaterials, bioorganic chemistry, translational diagnostics, disease biomarkers, and point-of-care diagnostic technologies, with an emphasis on improving early disease detection and personalized therapeutic strategies. Through his work at the PMIND Research Lab, he contributes to cutting-edge research aimed at bridging laboratory innovations with clinical applications, supporting the advancement of modern diagnostics and precision medicine approaches in global health. Today in this session, he will going to deliver a talk on medicinal chemistry exosomes. So now the platform is to you, sir. You can start your session.
Thank you. You hear me first. Thank you to all. You hear my voice?
Yes, sir. It is audible.
Clear?
Yes, sir. It is clear also.
Okay. Thank you. Yeah, thank you for wonderful introduction. Okay, my name is Dr. Anand Krishnan from South Africa, University of the Free State. Okay, I'm going to share my slide before my, my lecture. Okay. Can you see my slides?
Yes, sir. It is visible.
It's clear,
Sir,
huh?
please make it full screen.
Yes. I'll do that. So now, so full screen now.
Yes, sir. Yes, sir.
Okay, thanks. Okay, yeah. Good morning to everyone. I'm very happy to part of the faculty development program. Um, First of all, thanks to Dr. Samuel for introducing me this platform. My name is Dr. Anand Krishnan from South Africa. You can see my affiliation. My laboratory name is Precision Medicine and Integrated Nanodiagnostic, PMIND Research Lab, and Department of Hematology and Cell Biology, School of Pathology and Faculty of Health Science and University of the Free State from Bloemfontein from South Africa. Okay, today actually, I understand this is faculty developed program, B.Pharm and M.Pharm related student and researcher participating this program. So I decided to discuss some of the research we did in our lab previously. So that work I'm going to present, especially how small molecule means a drug molecule and the exosomes. Exosome, I will explain what is the exosome, how controlling the cell to cell communication. Okay, so this is my topic I'm going to discuss. This is going to be a very general, and because I want to teach something for the students, because it's a faculty development program, So I want to teach something from what we learn from our lab. So I want to explain something about our research also. Okay. So this is our topic. You can see molecule with exosome controlling cell-to-cell communication. Okay. Okay, before I go to mainstream of my discussion, you can see my small introduction about me because I just want to introduce about myself. I did my master in Bharat University in India, and I did my PhD in Durban Institute of Technology in South Africa, and I did my postdoc in University of KwaZulu-Natal in South Africa. Okay. Okay, you can see small, about my institution where I was currently where I am. You can see Durban Institute of Technology and University of KwaZulu-Natal, and currently you can see I'm the medical school University of the Free State. Okay. Okay, what is integrated research methodology? You can see I'm a chemist. So how I move to clinical research? Now I'm working with the medical doctors and a clinician and a pathologist. Basically, I'm a chemist, actually organic chemist. How synthetic chemistry leading to clinical chemistry. This is my travel from synthetic chemistry to clinical chemistry. You can see I started with the synthesizing small molecule for a cancer cell inhibition. From that, I try to develop, how to control DNA and RNA. Then currently we focusing on how to control exosome communication by using small molecules. So this is small how my research field I'm integrating with the laboratory to clinical research. Okay, so this is a medical chemistry point of view. I decided to put my slides. You can see I started my research career with the nitrogen heterocycle chemistry. So what is the nitrogen heterocycle chemistry? Is any drug made of with the nitrogen molecule that's called nitrogen heterocycle molecule, because our DNA made up with the, you can see adenine, thymine, and guanine, pyrimidine, RNA made up with the cytosine, thymine, uracil. These are our DNA backbone molecules. So what we decide to, we develop the, mitigate same like nitrogen heterocycle molecule, because you can see my drug molecule, what we developed long time before, not now. This molecules is called a DNA intercalator, because this is also acts as the DNA base and the RNA base molecule. So this can be interact with the DNA and RNA. It will change the DNA function and RNA function. So this is called a culine molecule. We work out carbosol, culine, this kind of molecule we synthesis and we develop this molecule for inhibiting DNA and RNA. Okay. So this is a nitrogen heterocycle chemistry background. Um, these are the molecule we develop our lab. You can see we use chloroquine and we modify the chloroquine, and we work with the cancer proteins. So this slide you can see some of the molecule we synthesis in our lab, and we characterize by using NMR, and we tested with the cancer cell line. We developed something like a bioinformatics, how this drug molecule interacting with the protein, so how inhibiting the protein. So this molecule we developed in our lab. These are all the molecule in a novel molecule. It's a nitrogen heterocycle molecule is containing fluorine and sulfur. Because why we introducing fluorine and sulfur? It have fluorine have highly electronegativity properties. It can more engage the protein binding because of the it's highly electronegativity is more binding with the, it create like a hydrogen bond and I mean a covalent bond with the protein molecules. Sulfur also do same thing. So along with the nitrogen heterocyclic molecule, we introduce fluorine and the sulfur molecule to engage in the protein binding. Okay, so we are group working with the fluorine containing nitrogen heterocyclic and sulfur containing hydrogen heterocyclic molecule. We develop this kind of molecule. This is small, like because I want to teach something like what for fee from student. We start from the auto tag, how protein molecule. Before we deciding the drug, we need to study the protein molecule. So by using this software, we try to develop, like how protein, structure and amino acid sequence, everything we want to study through the AutoTac. So this is the starting point of, honor student and a P.Tech student for to learn what is AutoTac. From that, you can explore, the research field of bioinformatics and the synthetic field. Okay, so this is one of the work, our lab, we published in a blast one. You see, we took the two small molecule, acetyl acetone and three amino carbosol. We developed EC-cap, is a carbosol, derivative, is more binding with the DNA molecule. So this is work we developed. You see, you can see the title of the article, cytotox effect on synthetic carbazole in A549 lungs cancer line. We published this article. So this article, we found this carbazole molecule binding with the DNA, it is damaging the cancer DNA. So it's good for DNA intercalation, especially cancer DNA intercalation. Okay, so is the final after DNA damage, the cell got apoptosis. It means the cell get death, the cancer cell get death because of the carbosol easily bind with the DNA, cancer DNA. Okay, so this is something we did with the same molecule we did with the case-based activity and the P53 protein inhibition study as well as. Okay, you can see this is a carbosol damage the DNA. You can see chromatin assay showing DNA damage in A54 cell line after 24 hours treatment. So these are our result. So you can see the flow cytometry detail. So we done some good work. We published in a plus one. Okay. After that, we did microRNA profiling by using microbus software. Okay. So what I'm trying to say, the small molecule, especially nitrogen heterocycle molecule, is good for DNA binding and RNA binding because of it have a nitrogen molecule. It acts as a base, look like the DNA backbone molecule like adenine thymine. So it is also will bind in a DNA DNA pair somewhere in the any where the mutation happening. It will bind because of this nitrogen heterocycle have a property to bind with the DNA and the RNA because of the nitrogen molecules. Okay, then after that we switch over that synthetic field to nano drug delivery. Okay, because of we have issue with the solubility issue and the toxicity. We try with the normal cell, it has some toxicity issue. So how to reduce the drug toxicity by using nano formulation and the drug delivery method. So we came up with a new idea. Using gold nanoparticle, we try to develop our synthetic molecule to do cancer cell or any disease cells. So here I used gold sulfur interaction concept because always gold nanoparticle easily can bind with the sulfur molecule. So I use this technology to deliver my synthetic drug into cancer cell by using gold nanoparticle because gold nanoparticle have less no toxicity, is not giving problem to any kidney cells. So we use gold nanoparticle to deliver our drug to particular cancer cell lines. Okay, you can see small video clip because of I tried to teach and understand how the gold nanoparticle can use for drug delivery for especially for particular cancer cell line target therapy. Okay, you can see the gold nanoparticle coated with the drug molecule and they reach with the blood vessel and they reaching to cancer cell. It try to destroy in the cancer cell. So this is just animation video how this golden nanoparticle can work for drug delivery, for delivering our drug molecule for his. Okay. Okay, you see, this is one of the work we did in our research, our lab. You see that same kind of carbosol molecule we connected with the sulfur containing small molecule. We synthesis molecule in our lab, then we use gold chloride solution. We try to synthesis gold nanoparticle and try to bind with the gold surface. You can see this, you know, it, yeah, you can see this is our new molecule which have sulfur compound, and we synthesis golden nanoparticle and we coated with our golden nanoparticle with our synthetic drugs. Okay, you see here. We use carbazole and we use liboric acid. We synthesis the our target molecule. You see the carbazole act as a DNA intercalator. The sulfur compound act as a golden nanoparticle surface binder. So we binding with gold surface. We develop this molecule. Um, you see that we target cancer cell line. We it work very well. Actually, we synthesis and characterizes and we use in anti-cancer activities. Okay, so now I'm entering to new field. This is called exosome. I was discussing about small molecule synthesis, and I was discussing about how small molecule we can use golden nanoparticle deliver in the cancer cell. Now, so totally different from what I discussed before. This is entering to a new field called exosome. Um, we working for clinical research. We try to use for biomarker studies and in the patient samples. But in meantime, our lab, some of the master student and honor students working with cancer cells derived exosomes, how to use our synthetic molecule to control the exosome by for same like a because this exosome have a property to transfer whatever parents cells have is to convert transfer to other cells. So you can see this picture will explain exosome how carry all the molecule and targeting other cells. So for example, cancer cell exosome can spread through the communication through the blood vessel. It convert into normal cell to cancer cell because of this cancer derived RNA and DNA. The genetic code can be used for normal cell to cancer cells. So what we decided, we want to target this exosome by using the small molecule. So we tried to develop exosome inhibitors actually by using synthetic background. So we study the exosome protein, then we 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 design the drug molecule for how to control the exosome because of we don't want we want to stop the exosome spreading the cancer mutation to normal cell cancer cell to normal cells. So this is currently one of the my students working on this kind of project. Okay, so you can see what is the exosome. See, exosome is a cell-derived material. It's a spherical material. It carried all the genetic, proteins and genetic things. You can see the surface protein like a CD biomarker, and other lipids and a glycoprotein. So these are the surface biomolecule. The inside the exosome, it have all the nucleic acid and the transport membrane transport proteins and most of the hits are protein. So whatever parent cells like the cell cancer cell have genetic things, it will carry to one place to another place. So this is exosome actually. um, See how the exosome interacting with the surface of the other cells. You can see the exosome have RNA and nucleic acid, all the nucleic acid protein. It have it while interacting with the cell surface, then it fused with the cell surface, so it converted to normal cell to cancer cell. Okay, see here you can see the cell membrane and how exosome interacting with the cell surface actually. Okay, um, you see here how the cell to cell, how the exosome, traveling through the now interorganal tubes actually. So what is the meaning of this? Means that this is, you consider as a cancer cell, this red particle is the exosome is traveling to normal cells. So this means this exosome is playing important role for spreading the cancers. Maybe it's not about not only spreading, it is the origin of the cancer cells, convert into maybe normal cell convert into cancer cell by using the exosome genetic things. So we need to control this exosome, to inhibit the exosome. So that's why we designed this kind of project actually. Okay. So, but exosome can act as a biomarker and a target and a drug delivery actually, because there depends upon the how we using the exosome. For example, um, inhibiting exosome one type of project because of we targeting cancer related, but also the exosome can use as a drug delivery because of for example stem cell delivery exosome can use as a drug delivery, and some disease delivery exosome we can use for biomarker identification, and we can use exosome as a target delivery method. So there's so many applications there. For example, you see the exosome diagnostic, we can use exosome for a diagnostic from because exosome can find saliva, blood, urine, and breast milk, everywhere in a human body where the liquid biopsy is there. So we can isolate the exosome from there. We can use the exosome as a disease biomarker. Okay. Then you can use the exosome biomarker selection for precision medicine. For example, you see the patient, we isolating, some macrophage, we culturing, then we isolate the exosome. We can use the same exosome for drug delivery for same patient. So this is nowadays cell therapy and exosome therapy. They're developing like this. Okay, the same exosome we can use for drug delivery. Okay. Okay, now you see this is the work done by Japanese scientists. Litagos long-acting antifungal agent and oral active for exosome secretion inhibitor. Okay, this is the one of the molecule, nitrogen-based molecule. They using fungal and bacteria virus infection. It is stopping the exosome production. So that means this is we want to stop that exosome production because of exosome can spread the fungal infection. So we need to control that exosome spreading with the normal cells. So they're using this drug molecule to inhibit the exosome from the fungus. Okay. Okay. So now we want to develop a exosome inhibitor based on tetrafin protein because exosome surface protein playing important for exosome transport purpose. So we developed drug molecule for this protein inhibition. For example, CD81, CD9, CD63. So we develop drug molecule inhibiting this kind of protein, surface protein. Okay. So CD81, one of the protein, in a exosome surface. So we was targeting the, inhibiting the exosome CD18 protein. If inhibiting the CD18 protein, the exosome function will stop. So we decided to develop a drug molecule for inhibiting CD81 protein. Okay. So you can see we published article, like a discover new novel binder for exosome protein. Okay. You see this molecule, based molecule, and we develop a nitrogen sulfur based molecule. Is a planar molecules. It look like a DNA intercalator as well as protein inhibitor. So we use this molecule to inhibit CD81 protein. So the CD81, you can found any type of exosome. So we target CD81 by using this molecule. You can see here, just we did first a DFT calculation, what is the binding site for our molecule, then we did molecular tracking for which is the best binding site for CD81. Um, Yeah. This is also, we developed this kind of fluorine-based molecule, like from the fusaric acid, fungal derived secondary metabolics. We modified this fusaric acid into different molecule and a fluorine content molecule and a nitrogen content molecule. By using this small molecule, we try to inhibit HSP19, which is involved cancer, exosome cancer metastasis. Okay, this is we target HSP19, which is present in exosomes. So our molecule, it have a proper to inhibit HSP19, which is present in an exosome. Okay, so yeah, you can see this picture how clearly this is cancer cell, produce exosome. This exosome carried HSP19. So this protein we inhibiting, then means this exosome, have a property for spreading the cancers. So we stopping this function by using our molecule, we targeting HSP19 proteins. So this is the way we develop the new project. So we developing drug molecule to inhibiting the cancer derived exosome to stop to stop exosome to destroy the normal cells. Okay. Okay, this figure will explain clearly how this cancer cell, exosome, the blood vessels, how, travel. This exosome can, affect the normal cell. This is the way metastasis happening in the body. So when a cell got cancer mutation, it start producing the exosome. The exosome carry that genetic material. It reacting. It mean it interacting with the normal cell, it convert into normal cell to cancer cell. So our way of designing the project, we want to stop this exosome by using the small molecule. So we did that one actually. Okay, so also future plan. So far, I discussed about cancer-related exosome, how small molecule playing important role, like inhibiting the exosome. So I discussed about medicinal chemistry point of view. Now this is recently, some of the research group working with the plant-derived exosome, how we can use drug delivery. Okay. These are the exosome, companies coming up because of, this is a new field, emergency field. Very recently, a lot of people set up one company for exosome related. It's not only, therapeutic point of view, diagnostic point of view, cosmetic point of view. It have a multi application. Okay. So in the future, any young researcher, if they want to focus on exosome, you see this is the value of exosome project. It's not like something small, something like that. This is very interesting project. A lot of company want to invest this kind of project actually. Okay, so finally, this is my reference. Um, okay, so now I just want to explain about where I am from. South Africa. So world-ranking university. South Africa is a wonderful, semi-European African country, because there are multinational people living there. Like you see the top university in a world-ranking. You see our India institution, well-ranking compared with the South Africa. They are very good university there. You welcome to come and do PhD and postdoc there. So higher education very good. So it's a English speaking country. So you will get to very good explore where you want to get from Europe and US. You can get from South Africa also because we have very good university, top ranking university in South Africa. Okay, these are the some funding for a PhD and postdoc is called NRF, National Research Foundation. You can apply fellowship and postdoc fellowship and PhD fellowship. There are so many Indian students studying there and doing research there. So if you want to come to South Africa, you will come to contact me. I will share my information how to study in South Africa. Okay, thank you. I'm done with my presentation. If you have any question, you're welcome to ask. I will explain.
Thank you, sir. It is a very insightful session about the exosomes and its medical chemistry aspect, medicinal chemistry aspect, as well as its application. So there is no questions in the chat box. I have one questions from one side about the that how we can determine, how we can ensure the purity and the reproducibility of these exosomes in case of therapeutic application. So can you please give me a insight?
Okay, purity. Okay, after isolating exosome, any cell media or a patient sample, even we are working with the patient sample, isolating exosome in the plasma serum. First thing we used to do, what type of isolation method we following? Okay, there's so many isolation method is there, but we always recommending size exclusion method by using column because that method can capture your pure exosome instead of capturing virus also small particle instead of capturing virus instead of parting apoptose bodies cell also have debris, so we use column which is have antibodies connecting with the column silica gel, so that column won't capture only exosome which have CD biomarker. I told you, CD9, CD81. It capture the particular exosome and not instead of capturing other virus or bacterial bodies. So that's the first step. We thinking about purity, sensibility to capture the exosome. Then after capture, we isolating exosome. First thing we do gold standard method. Always exosome. So many people do TEM analyze, NDA analyze, DLS. But first thing you have to do Western blot.
Western.
Western blot is a very gold standard method for confirming exosome purity with positive control and negative control. We used CD81 is a positive control. We also use negative control also, which is cell surface protein. So we want to say the negative biomarker not present in the exosome. So always use a positive control and a negative control. The negative control will prove your cell protein not there. So that is second thing we want to do Western blot. The remaining thing we'll do other things like NDA, nanoparticle tracking analysis, and the term sum. Okay. The main thing Western blot will prove your exosome is purity or some other you isolate wrong antibody apoptosis body or necrosis body or viral body. You will. So this is the thing we want to do in our lab. So I can recommend first isolation, which isolation method you doing. Second thing, which characterization doing. Yeah, Western blot.
Okay.
Yeah.
Yes, sir. Another one question from the from our participant side. It is from Tarigopulla Sunita ma'am, and she's asking about that. Can we go for alloy nanoparticles for N and S molecule?
Which molecule? Which nanoparticle?
Alloy nanoparticles. He's asking.
Alloy.
Yes, yes, alloy. ALLOY.
Alloy means metal.
Metal alloy.
Metal.
Yes.
Yeah, actually, we use, you see, we use gold nanoparticle. Nowadays, they're using carbon content dots also. So, carbon content also, alloy metal nanoparticle also good for, delivery. But you have to choose which metal good for kidney cells. Because for we targeting cancer cell was okay, but what about kidney cells? So we don't want to damage our kidney during our drug delivery. I mean, drug inhalation, drug absorption. So gold nanoparticle, somehow silver nanoparticle have some, benefit for, our healthy kidney cell, but depend on the concentration also. We don't want to
Okay.
go for too much concentration. We don't want to go, kill our kidney cell. So this is more into pharmacokinetics and the formulation is going to that place. So we can use alloy nanoparticle, but which metal you choosing? sometimes, people want to publish article, they choose copper nanoparticle, they choose, lot of metal nanoparticle because they want to publish article. But when you go into cell culture work, when you go into, biological application, you will realize, no, this is not going to work for our normal human cells, especially kidney cells, like that. So we need to choose the metal which is not affecting the our normal cells. So whenever you working with the cancer cell, you also try with the kidney cells. How it is giving toxicity for kidney cells. Then only you need to go. You have next level. You have to take it. I was just publishing one article. You cannot say this is working very well like that. Okay. So for me, golden nanoparticle. So far, golden nanoparticle okay, but depends upon the concentration. You can include alloy silver nanoparticle also, where silver also is a good antimicrobial property, and somewhere health benefit we have. We also traditionally we proved, Ayurvedic proved gold and silver have some medical properties, but depends upon the how much we concentration we using for biological application. Yeah.
Okay, thank you, sir.
Mm.
And the last question is that whether we can use this exosome for wound healing also.
Yeah, actually, wound healing is exosome is one of the best application is a wound healing, especially diabetic wound healing. Okay, so I want to share something. We did some stem cell project. One of my master student, stem cells, adipose stem cell exosome, have a regenerating cell regenerative properties. So they use a stem cell derived exosome for wound healing, cell regenerating therapy, especially diabetic wounds. We can use a stem cell derived exosome for regenerating the genetic cells actually. So it's very good application. But which exosome you choosing? You cannot choose plant exosome. You cannot choose some other stem. For me, stem cell derived exosome good for regenerative medicine, especially regenerating skins, regenerating wounds, skin, damaged skin, dead skin actually. Yeah.
Thank you, sir. And no other more questions yet. So thank you, sir, for your insightful sessions and also your beautiful deliberations about this exosome. Now I like to tell our technical team to please share the token of appreciation to Dr. Anand Krishnan, sir. Sir, this is a small token of appreciation from our side.
Thank you. Thank you, sir. I
Okay.
really appreciate your team, and especially Samuel is my best friend for 3 years. I think he was
Yes.
contacting me to present. I didn't say anything, even though I'm on holiday in the India. So I said, no, Samuel, I will present. I didn't say anything. No, Samuel, I want to do something work because he did so much good work with me,
Yes.
and I thanks to him, and thanks to your team and your institution. Not only this FTA program, in future any help for student and researcher, if you want some information from Africa platform, Africa country, because I'm at 15 years in South Africa, I know all the detail about the university, what type of funding, how the safe in the place, what type of university is there. Any detail for student and staff for help from my side from Africa, please let me know. Please
Yes,
discuss
sir,
with
definitely.
someone. We will help you. Okay.
Yes, definitely,
Okay.
sir. Definitely, we will come
Thank
get back to you. Thank you, sir, for this
thank
session.
you.
Once again, thanking you for presenting your deliberations today.
Thank you.
By this, we can end today's day 5 FDP session.
Thank you. So
Thank you,
I'm
sir.
leaving. I'm leaving now. Thank you.
Yes, sir. Yes, sir.
Okay. Thanks.
So, participants, thank you for being there in our session. So, next on Monday, we will continue our day 6 session. So, for that, thank you.